The people voted for it, but the United States Congress rejected it. And just a few years later, in 1889, we did receive statehood from the United States Congress. But Walla Walla was the first. It's still one of my favorite places.
We're hoping we can get a sizable population in each area within 3 years.
We're always on edge, hoping that whenever the next storm rolls through, that lightning doesn't strike in our area to burn down more habitat.
This beautiful little bay on Bainbridge Island is called Port Blakely Harbor. It was once the site of the biggest sawmill in the world. It's a deep water harbor and had as many as 14 sailing ships in here to load lumber that went to every possible location around our globe. There was huge timber around Puget Sound, and they brought it into this harbor in log booms and then ran the logs through the mill. They were massive. My dad told me that he could hear the logs going through the mill 4 miles away. The whine of the saws was that loud. This produced a product that the locals used to call Port Blakely toothpicks. They were beams as big as 24 inches by 24 inches, some of them 90 or 100 feet long. That's a different world than we live in. The timber was huge. They went into the mines in Montana and Idaho. There's one that's been brought back and is used here in Bainbridge Island. As the years went by, the mill deteriorated, eventually burned and was closed down. Today it's just a beautiful spot, and it's truly one of my favorite places. Wow, this is impressive. We're here on the southern shores of Lake Union at Mohi, the Museum of History and Industry. For many years, this was the Naval Reserve Center and the armory for Navy uses here in Puget Sound country. And if you go up on the 4th floor, you'll see where they train young sailors to be skippers of the ship, because there weren't enough ships to trade on, so they used this building as an actual training location. It was the first command of many young sailors. Many museums concentrate on what happened after European settlers or Asian settlers came to the Pacific Northwest. But Mohi really concentrates on the people that were here before that as well. And their Native American stories and the learning experience about Native Americans is excellent here in this facility. Well, you've all heard about the B-17s and the B-29s and all the Boeing manufactured airships during the war, and then the commercial airplanes. But behind me is B-1, Boeing's first aircraft that he wanted to prove to the world that not only could people fly, it could fly commercially, it was an endeavor that would work, and carrying the mail and carrying passengers as well. Innovation that started in Seattle and remains in Seattle today. And look here, this is Slow-Mo 4, Seattle's favorite boat. We all remember, at least if you're my age, you certainly remember that first Gold Cup race in Seattle. She came out from under the bridge and the starting gun went off, and those Detroit guys were flabbergasted. She beat them hands down. Slow-Mo 4 will always be my favorite hydroplane. In some ways, the story of Washington State is also a story about beer. There were breweries in Longview and breweries in Vancouver and breweries in Tacoma and breweries in Seattle. Maybe the two most famous ones are the Olympia Brewery and the Rainier Brewery in Seattle. My great-grandfather was a barrel maker that worked at the Rainier Brewery for many, many years, and the big R on the wall back there brings back lots of fond memories of the enjoyment we had on a Sunday afternoon sitting around the table enjoying a glass of Rainier beer. This facility has virtually millions of artifacts, historic documents.
Good morning, everyone. I'm Suzan DelBene, the Congresswoman representing the great 1st Congressional District right here in Bellevue. I want to thank all of you for joining us today. And a big thank you to our House Democratic Leader, Hakeem Jeffries, for joining us. Where is he? Right there. There you are, right next to me. For joining us in the beautiful Pacific Northwest. We're very honored to have you here. It's a pleasure to have Governor Ferguson, Congresswoman Schrier, Commissioner Kuderer, and Maya Tusing, a small business owner from Woodinville, all here with us today. I also want to give a very, very special thank you to John Duarte and everyone at Overlake Medical Center for hosting us here in this beautiful spot today. We're here today because of the damage being inflicted on our healthcare system by President Trump and congressional Republicans. They passed the largest cut to healthcare in American history, and the policies that they have enthusiastically put in place are leading to skyrocketing healthcare costs. They're ripping coverage away from millions of Americans, and it's likely to force providers to limit access to services and close facilities. The administration is also making draconian cuts to our medical research institutions, hollowing out our public health agencies, and further putting our health at risk. Our speakers today are going to touch on these issues in greater detail, but I want to draw specific attention to the Enhanced Affordable Care Act health insurance subsidies that are set to expire at the end of this year. Earlier this week, Commissioner Kuderer's office released the final 2026 insurance rates for the Washington Health Plan Finder, showing a 21% increase in the cost of coverage from this year. That's one of the sharpest increases we've seen in years and nearly double the year prior. Democrats enacted these enhanced subsidies in the 2021 American Rescue Plan to lower the cost of care for millions of families across the country, and it allowed 4 million more Americans to have coverage. In Washington, over 216,000 currently rely on the subsidies to afford their health care coverage. And because of the Affordable Care Act, we've gone from a 14% uninsured rate here in Washington in 2013 down to a record low of 4.8% in 2023 with those enhanced subsidies. That's below the national average. We've come far in making healthcare more accessible and affordable, but we still have much more work to do, and we should be talking about what we do to go forward, not going backward. Everywhere I go across our state and across our country, I hear the same thing from families and small businesses. Healthcare is too expensive. Today, nearly half of adults say it's difficult to afford healthcare costs. A third of them have skipped or postponed getting needed healthcare because they couldn't afford it. Over 1 in 5 have gone without a prescription that their doctor prescribed because it was too expensive. That's why these subsidies and protecting Medicaid are so important. But the Trump administration is moving us in the wrong direction. If you combine the rate increase for next year with the loss of subsidies, the average Washingtonian on the exchange will see a 65% increase in their health insurance premiums next year. That translates to spending $1,300 more a year for premiums alone. That's an enormous jump that will make coverage unaffordable. Think about the kinds of people who get exchange coverage. Small business owners like Maya, early retirees, part-time and gig workers, and younger Americans. 80,000 people here in Washington are expected to be forced off of their coverage if Congress lets the subsidies expire at the end of the year. That's a massive cost to everyone when people lose access to health care. When people can't get preventative or primary care, it costs us money. When they can, it saves us money and it saves lives. Democrats stand united in strengthening our health care system, including extending these subsidies and making them permanent so people don't have to choose between the care they need and keeping a roof over their heads or food on the table. Republicans, on the other hand, have continuously opposed them. No Republican has voted for the ACA subsidies. While they were trying to pass their mega bill, Republicans voted against multiple amendments that we put forward to extend the subsidies. The big ugly law failed to extend these subsidies and made the biggest cut to Medicaid in history. And why? So the ultra wealthy could get a huge tax break. It's that simple at the end of the day. We're going to keep fighting against this assault on our healthcare system and protect the lives and livelihoods of families across the country. I appreciate everyone being here today, and we have a great hero in that effort to help make sure that we continue to protect healthcare. Who's leading that fight for us in Washington, D.C., our House Democratic Leader. We're so honored to have him here. I want to introduce Hakeem Jeffries.
Thank you. Good morning. It's a high honor and a distinct privilege to be here, certainly with my good friend and colleague and amazing leader in the Congress, Congresswoman Suzan DelBene, who is a tremendous champion for this district, for the people of the great state of Washington, and all across the nation. And of course, it's wonderful to be here with Dr. Kim Schrier, another amazing member of the Washington delegation, with Governor Ferguson, who's doing a tremendous job. Madam Insurance Commissioner, thank you for your leadership. And of course, to the healthcare heroes here at Overlake. Thank you for what you do. It's wonderful to be in the Pacific Northwest. It's great to be with folks who are smart and strategic and substantive and be able to say I'm in Washington at the same period of time. Because that is certainly not the case when I'm on the East Coast in the Republican-controlled Congress, who continue to bend the knee to Donald Trump's extremism, particularly as it relates to an all-out assault on the health care of the people of this great country and the people of this great state. Donald Trump and House Republicans have created a health care crisis in the United States of America. It's an unprecedented assault on the health care of the American people. The largest cut to Medicaid in American history, ripping health care away from tens of millions of Americans, forcing the possible closure of hospitals, nursing homes, and community-based health clinics. Tens of millions of Americans, including hundreds of thousands here in Washington, likely to face dramatic increases in their health care premiums, co-pays, and deductibles as a result of the continued Republican refusal to extend the Affordable Care Act tax subsidies, which are so important to lowering the high cost of living for millions of people all across this country. Republicans are continuing that health care assault by now trying to jam an appropriations bill down the throats of the American people that attacks medical research, attacks vaccine availability, attacks the Centers for Disease Control, and attacks public health infrastructure in America and here in the great state of Washington in an unprecedented manner. House Democrats are prepared to find a bipartisan path forward and reach a spending agreement that meets the needs of the people of the state of Washington in terms of their health, their public safety, and their economic well-being. But it has to be bipartisan, and it has to take serious steps to fixing our broken healthcare system, a system that is being broken even further by Donald Trump and House Republicans in Washington, D.C. We believe as Democrats that in this great country, the wealthiest country in the history of the world, access to high-quality health care should not simply be a privilege for the wealthy, the well-off, and the well-connected. It's a right that should be available to every single American. And no matter what it takes, House Democrats and the leaders of this great state are committed to making sure we bring that right to high-quality health care to life and aggressively push back against this unprecedented Republican assault on the health and well-being of the American people. It's now my honor to introduce another amazing colleague in the Washington delegation, someone who, of course, prior to serving in Congress, served the people of this great state as a pediatrician in such a phenomenal way. She's no stranger to an environment like this, and I now yield to the distinguished gentle lady from the great state of Washington, the Honorable Dr. Congresswoman Kim Schrier.
Thank you, Leader Jeffries. Thank you, Congresswoman DelBene. Thank you, Governor Ferguson, Commissioner Kuderer, and to our healthcare workers and everyone who's joining us today to talk about this really important issue. I am not a stranger to places like this. In fact, I used to come here and see babies early in the morning who were just born, and so I do know my way around. John, I want to thank you for welcoming all of us here to Overlake Hospital today to discuss the threats that are facing patients, but also facing our entire healthcare system because of President Trump's One Big Beautiful Bill. As you heard, before becoming Congresswoman for the 8th District, I practiced as a pediatrician in Issaquah. And being in the exam room gives you a really up-close look at healthcare and what it means for families. And I reflect back on some of the shifts that I worked in emergency departments. And certain stories just stick with you. I mean, I remember a kiddo who came in with something called mastoiditis. It's an infection in the bone behind your ear. And it happens when you don't get an ear infection treated. It's really serious. Sometimes it needs surgery. It can extend and become meningitis if it's not treated with IV antibiotics. And he ended up in the emergency room because his family didn't have insurance. I remember another child who came in with terrible pneumonia. Pneumonia often can be treated if you see your primary care doctor and you can get oral antibiotics and you do okay. Well, this kiddo was so sick by the time he got to the emergency department, again, because the family didn't have insurance, that he needed to be hospitalized. He needed to get IV antibiotics. He was so much sicker. And this is just a taste of what is coming to this state, to this hospital, and to this country, because congressional Republicans and Donald Trump have taken a hatchet to Medicaid and to ACA subsidies, and this will impact millions of Washingtonians. So we're about to see 16 million people in our country lose their health insurance, and they're going to be in the same situation as those two patients. They're not going to have access to primary care. They're only going to get care once they are seriously ill. They're going to get it in the emergency department where it costs the most. And we're going to see more hospitalizations, more serious illnesses, and worse outcomes. Now, on top of that, hospitals like Overlake will be providing that care for free. And that's not sustainable. And so some hospitals will close, and other ones will limit services. And by the way, the first one to go is labor and delivery. And in my district, a rural district, that could be a life or death situation for new moms and their babies. Valley has already laid off 200 people. So a quarter of Washingtonians, that's nearly 2 million people, rely on Apple Health. Almost half of those are kiddos. And I also don't want anybody to think that they're safe because they have private insurance. I mean, in order to keep this healthcare system afloat, somebody's got to pay. So insurance companies are going to fork out more. They're not going to do that from the bottom of their heart. They're going to charge all of us more in higher premiums, higher deductibles, and higher copays. I also don't want you to forget the impact on all of us when the emergency department is more crowded and we wait longer. This is not theoretical. Like, we're going to get hit with the first wave of this just in the next few months. It's open enrollment season. People are going to get those statements in the mail. And because Trump and congressional Republicans purposely decided to end the cap, the 8.5% of income cap that we put on ACA insurance plans, the average Washingtonian on the exchange is going to see a 65% hike in their premiums. And I know you'll hear from Commissioner Kuderer in just a few moments that she anticipates that because prices are going so high, 80,000 Washingtonians are just going to decide to roll the dice to not have health insurance. That is dangerous. The most despicable thing about all of this is that Republicans are kicking people off their insurance in order to pay for a tax cut for billionaires. It is going to destabilize our entire healthcare system. It is morally bankrupt, it's disgusting, and it is about to hit all of us really hard. My Republican colleagues know it. I mean, the day after they passed this big, ugly bill, they ran into committee to try to pass bills that would rescue rural hospitals. They know what they did was wrong. And I want you to know that Leader Jeffries, Representative DelBene, I, and all of our Democratic colleagues are going to continue to fight every day to restore Medicaid and to protect the ACA. And I know that our governor is fighting as well here in the state. This is going to impact our state's budget. And so I want to thank and welcome Governor Ferguson. Thank you.
Thank you, Congresswoman. First, let me start by saying I feel fortunate to live in a state where we are represented back in Washington, D.C. by members of Congress like Dr. Kim Schrier and Suzan DelBene. So thanks to the two of you for standing up for us. We so appreciate your service. Leader Jeffries, welcome to the beautiful state of Washington State. It's an honor to have you here. We so appreciate it. And a special thanks to our friends at Overlake, of course, for opening up this facility. And most importantly, as it's been said before, by all the workers, the folks who are here, which are really, the heart and soul of this place, who take care of Washingtonians. We so deeply appreciate your service during especially challenging times. So thank you all for being here and for all you do every single day. First thing I want to say is I think everything I had planned to say has literally already been said. I think every statistic to the point where I think literally, Dr. Schrier, the two words I was going to use to describe what's going on in Washington, D.C. by the Republican-led Congress and by Donald Trump, the way to describe this action, the adoption, the big bad betrayal of a bill, the two words I was going to summarize all of that in were the words morally bankrupt, which is exactly what I think you said when you described it yourself. But it is what it is. This is all morally bankrupt. It is totally upside down. I say that as a governor, obviously. I say that as the father of teenagers. I say that as an American. I say that as a person of faith. I'm not sure what kind of a system we're living in anymore in which Congress, Republicans in Congress, over the objections of the leaders we have here, adopt a big bad betrayal of a bill that literally takes from the lowest income Americans and transfers that to the wealthiest Americans. It's been described as the largest transfer of wealth in the history of our entire country. I would say, as a person of faith, that disgusts me. That is upside down. That is wrong. That is morally bankrupt. There is no other way to put it. And what we're talking about today, this goes into effect January 1. This is right on top of us. This is happening right now. And so we all need to speak out with clarity about the challenges we're facing and what this means for 286,000 Washingtonians who are enrolled in private health care plans through the Health Benefit Exchange. And I think the number that was mentioned before, at least 80,000 Washingtonians can only afford their private health care plans through the exchange because of these tax credits. If these credits go away, so do their health care plans. For the others who manage to keep their health coverage, those Washingtonians will see their costs skyrocket effective January 1. Look, we're going to have some big challenges as a state to grapple with the impacts of this if it goes forward. But right now, we need to be clear in our objection to this, to communicate to the American people what's at stake and what this means for them. And I just want to conclude by saying how much I appreciate the hard work being done in the other Washington by the folks here. It's a challenging time, and unfortunately, I actually have to leave this press conference a little bit early to fly to Eastern Washington for another press event for another Trump action that's going on that's going to impact hardworking Washingtonians at the Hanford Nuclear Waste Facility. But that's a sign the times are in, Leader Jeffries, right? That literally we can have actions going on that are impacting Americans at so many different levels. But to me, what sustains me, honestly, at times like this, being a glass half full kind of guy, are the folks here who work at Overlake, right? The Washingtonians are working every single day, right? Despite all the chaos that's going on, that are impacting the important work that you do, that you're there every day, putting your heads down, providing really important services to the people of our state. So as the governor of the state, and as a dad of twins, young twins, I so appreciate all your service. Leader Jeffries, thanks for being here, and thanks, Congresswoman, for setting this up. Thank you all so much. Appreciate it. And with that, by the way, before I leave, I have an important introduction, which is a fantastic leader for our state, is our Insurance Commissioner, Patty Kuderer, who has a challenging job these days, but she's leading with great integrity, has been a fantastic state leader for us, so please join me in welcoming Patty Kuderer to the podium.
Thank you, Governor Ferguson. Really appreciate your perspective on this. And I want to thank Congresswoman DelBene for convening this, and Leader Jeffries and Congresswoman Schrier for being here today. So this week, my office approved the 2026 individual health insurance market rates with an average increase of 21%. These increases are not just happening in Washington. Across the country, proposed rate increases are in line with what we're seeing here. While the premiums that Washingtonians will see as a result will vary based on their own situation and whether or not they get a subsidy, I know that these increases are going to be incredibly hard for the families already being hit by higher costs. I want to clarify that my authority as Insurance Commissioner is limited. If insurance companies can properly justify their rate increases, then according to state law, I must approve them. However, our staff does closely scrutinize the rates that the health insurers file in the spring to confirm those justifications. This year, insurers pointed to several things: increases in the number of people using services, hospital consolidation, and uncertainty at the federal level about the expiring enhanced premium tax credits as causes for these rate increases. If Congress were to extend the enhanced premium tax credits, we could see these rates lowered. Congress would need to act quickly, though, since my office would need to approve a new set of rates in time for the 2026 open enrollment. We know that the enhanced premium tax credits have helped increase affordability and lower the number of uninsured Washingtonians. Over 216,000 Washingtonians qualified for these credits just this year. That's about 2/3 of Washington's exchange enrollees. We enacted an emergency rule back in March to allow premium alignment in our state to help soften the impact of the expiring enhanced premium tax credits. The hope is that premium alignment will encourage more people, especially younger and healthier individuals, to stay insured and to help stabilize premiums for everyone else. Unfortunately, If Congress fails to extend the enhanced premium tax credits, the exchange estimates that up to 80,000 Washingtonians may forego coverage. That, combined with the changes in health care cuts under H.R. 1, will erase the gains made in lowering the number of people without health insurance and lead to higher costs and strains on our health care system as people put off preventative care. Simply put, it's time for Republicans to stop playing political games with our health care and make those tax credits permanent. Now you're going to hear from Overlake CEO John Duarte for a provider's perspective. Thank you all.
Thank you, Commissioner. Good morning. I'm John Duarte. I'm President and CEO of Overlake Medical Center and Clinics. We operate in partnership and are a part of the multi-care health system. And as that, we are a not-for-profit, locally governed, secular health system that provides comprehensive care to our communities. The Affordable Care Act and these enhanced subsidies have made health insurance accessible for thousands of Washington residents. Enrollment in the plans has grown to over 300,000 people in 2025, a huge increase in recent years. This means more people who come through our doors are getting preventative care and managing their chronic conditions as well. Fewer patients are uninsured. That supports both the health of the patient as well as the financial health of hospitals, and that is threatened. Hospital health is vital so that we can replace equipment, provide essential services, and ensure that our charity care programs remain sustainable. If these subsidies expire at the end of the year, we in the multi-care system anticipate a rise in uncompensated care and unpaid bills at a time when hospitals are already very financially strained. This threatens access to care. We are also very concerned about the Medicaid cuts and the programs that are represented there. Hospitals provide life-saving care to a high volume of patients 24 hours a day, 7 days a week, to all who walk through our doors. That requires significant resources. Here at Overlake, we served over 200,000 unique people last year. And within the multi-care system, there were over 1 million emergency department visits annually. That's almost 3,000 visits a day. Today, Medicaid only funds 70% of the cost of care provided. And without the directed payment program and the SNAP funds that come from that, the future of which is very unclear, Medicaid will fund less than half the cost of care. In the most recent year, the whole entirety of multi-care system Medicaid payment shortfall approached a staggering $500 million. With the recently passed legislation, at least 250,000 people are expected to lose health insurance in our state, and thousands more will no longer be able to afford private insurance. Estimates indicate that multi-care as a system stands to lose an additional $1.5 billion in funding over the next 10 years. Both Overlake and multi-care are committed to meeting the health care needs of our communities, both now and in the years to come. But to fulfill that commitment, we must protect the programs that make care accessible and sustainable. And I just want to say thank you to everyone here to support the message of protecting access to care in our communities. I'd like to turn now over to Maya Tusing, who will speak to the impact of some of these raised premiums on her family and business. So thank you, everyone.
Thank you, John. Good morning, everyone, and thank you, Congresswoman DelBene, for the opportunity to speak today. I know many Americans don't have this opportunity, so I really cherish the chance. My name is Maya Tusing. I live in Woodinville with my husband and my daughter, who is a high school student, but I also grew up not far from here on the east side of the Puget Sound area. 6 years ago, I launched a small business with a partner that helps small and mid-sized nonprofits manage their long-term funds and their short-term cash positions so they can have more philanthropic impact, particularly in this vital time of uncertainty. And we are a lean, mission-driven firm. We're growing, and most importantly, we love what we do. But like many small businesses, we're not large enough to provide employer-sponsored health care for me and my family. And that's why the Affordable Care Act was a lifeline for me and my family, because it allowed my business partner and I to focus on building out our small business, so I didn't have to agonize about where I could find health care coverage. So it was one less barrier to entrepreneurship, which is what the American dream is all about. At the time, it seemed like it was a stroke of luck for me. But while our firm was experiencing steady and reliable growth, and my personal income as well, my personal and family's premiums at one point skyrocketed 5 times in 1 year. And that was last year. And with the projected premiums increasing, as well as the tax credits potentially expiring, our premiums would double. So not the 60%. I did the math. It would double in 2026. So if you do the math, that's 10 times in 2 years, tenfold. And that's just premiums. That's not deductibles and copays. Now, I want to acknowledge that I am more fortunate than most Americans in this country. I have an MBA from the University of Washington, and out of that program, I was recruited into well-paying jobs. I bought a home. I fully funded my retirement. I was able to save so I could bootstrap to run the small business that they have today. But I never imagined that I would have to squeeze $1,000 a month to pay for the existing plan, which is a bronze plan that I have today. But for me, no coverage is not an option. I have a husband and a daughter that I care for, and presumably they care for me, so I want them to be healthy, and I think they want me to be healthy. I have a business partner who I'm committed to, and I have 2 new employees who count on me to be there every day. Case in point, last month I had COVID, and I had to show up because no one is there to cover for me. And funny, not funny story, my business partner and I had COVID on the same day that our new employees started their first day. Now, we're virtual, so that was not as much of a problem, but we had to show up to our home office for a week to onboard them, both with COVID. So, yes, we need vaccines, too. So it wasn't as bad. So I like vaccines as well, hint, hint. So if our financial position, my family's financial position, gets worse, at least my family could dip into our retirement. And a lot of Americans can't do that. And that, just saying those words boggles my mind, because in my industry, saying that I'm going to dip into my retirement before I'm of a retirement age is something that you're never supposed to do. I would be hit immediately with income taxes and penalties. However, every dollar that's allocated to coverage will be scrutinized to determine whether the corresponding care is essential. So, in effect, I'm going to ask, is my back really hurting? Do I really need that MRI? So Congress needs to recognize that, yes, the potential expiration of the tax credits and the premiums increasing will cause people to lack coverage, and that is a horrible, horrible thing. But this problem is even bigger. There will be patients going back on the exchange, forced to accept higher copays and deductibles to afford basic care coverage. And families like mine, who will be covered, will be living in the country with the largest GDP in the world, will be asking themselves, how sick do I have to be before I justify paying for that treatment? Thank you very much.
I want to thank all of our speakers. Thank you, Maya, for sharing your story, and I want to open it up for questions.
Hi, Anna Edgerton with Bloomberg question for you and for Leader Jeffries. I think most people in this district probably agree with you and, follow this closely and understand the importance of what you're talking about. How do you go into Republican districts or talk to your Republican colleagues and communicate that to people who aren't represented by Democrats and can actually, cast a vote that would give a Democratic majority or give, your party more power to fight back against this? And also, if you have any candid conversations with Republican colleagues behind the scenes about what they actually think of the impact on their constituents.
First, let me say, this isn't a partisan issue. If you talk to Americans across the country, one, they universally hate the big ugly bill. And why? One big reason is because of the massive cuts to health care. Because health care impacts every single one of us, every family across the country. People understand what that's going to mean for their families. And so when you talk to folks across the country in red districts, in blue districts, in purple districts, universally, people want affordable health care. They want us to address costs, but healthcare is beyond a cost issue. It's a cost issue, but it's also about making sure that my family, my loved ones, my community has access to affordable quality healthcare. So that is not partisan. In fact, if you kind of look at what's happened, you even saw many Republicans, even Senator Josh Hawley, the day after they passed the bill, put some bill out there saying that he needed to put the Medicaid dollars back. Pretty cynical to vote again for a cut and then to come back. But people know, because if they go home and listen to people on the ground, they hear how important this is for folks in every part of the country.
I guess strategically for Democrats, how are y'all spreading that message to the entire country, not just to the districts that you represent?
I think, we've been out talking, but folks across the country, insurance commissioners, getting information out. We want to make sure people understand the impact that's going to happen right now on premiums, that the impact on that Medicaid cuts has, but what it has right now in terms of costs for American families. These are for next year. This is for January we're talking about. The number one issue, again, for folks across the country is affordability, health care, child care, food, housing, energy costs. And every policy that Republicans put in place is actually causing costs to rise across the country. Even tariffs are impacting Overlake Hospital. Because of medical devices and PPE costs. These are all having an impact, policies that are not supporting the American people. And all policies that Republicans have put in place, Americans wanted lower costs, and it's been a broken promise from Republicans. I don't know, Shirley, if you want to add it.
Over the last several months, we have had an ongoing conversation with the American people about the devastating problems connected to the One Big Ugly Bill and the adverse impact that Republican policies have had on the health care of the American people. The One Big Ugly Bill is deeply unpopular for a variety of reasons, but right at the top of the list is because of the unprecedented Republican assault on the health care of the American people and the adverse impact that has on their quality of life and on the cost of living. This is part of a continuing discussion that Democrats have led in defense of the health care of the American people all across the country, from east to west and at all points in between, including in the heartland of this great country of ours, and that will continue. Republicans have had repeated opportunities to block the Medicaid cuts and to make sure that the Enhanced Affordable Care Act tax credits are continued. They have had repeated opportunities to do those two things, and they failed to stand up for the health care of the American people each and every time, which is why Donald Trump is unpopular and the One Big Ugly Bill is deeply unpopular all across the country, in Democratic districts and in Republican districts, and we will continue this effort relentlessly.
To clarify, Mr.
Jeffries, are you saying that your members will not vote to extend government funding unless these subsidies are extended? Is that where we're at this month?
We've made clear two things. One, House Democrats will support a bipartisan spending agreement that is negotiated between the House and the Senate if it lifts up the quality of life of the American people with a focus on three areas: their health, their safety, and their economic well-being, which means lowering the high cost of living. We will not support a partisan Republican spending bill that continues to gut the health care of the American people. Period. Full stop.
Do you feel the subsidies are line being drawn as your caucus in the sand on this?
We've made clear that the assault on the health care of the American people relates, unfortunately, to a variety of different things, including but not limited to the largest cut to Medicaid in American history, a possible $536 billion cut to Medicare, the expiration of the tax credits related to the Affordable Care Act, which is going to skyrocket premiums, copays, and deductibles for millions of Americans, setting in motion the possible closure of hospitals, nursing homes, and community-based health clinics, and now a continued assault on medical research, vaccine availability, and the public health infrastructure of the United States of America.
Last thing, can the Medicaid cuts be addressed through this funding process at this stage?
We need to cancel the cuts and save our health care. And there are a variety of different legislative vehicles available to do that. Republicans voted to impose these Medicaid cuts on the American people, and then, as Suzan DelBene pointed out, immediately thereafter started to introduce legislation to reverse the cuts that they voted for in the first place. Something is wrong with that picture. I don't get it. Legislate in a way that actually lifts people up as opposed to tearing people down here in Washington and across the country.
Last one.
And I just wanted to add real quick on that. The bill passed with like a single vote. Every Republican could have been the deciding vote to make a difference. Yes.
I just wanted to ask, are you seeing any signs from Republican lawmakers that they want to address the tax cuts before the end of the year?
I want to make sure that Suzan DelBene and her district gets the last word here. But this situation needs to be resolved, as the Insurance Commissioner indicated, sooner rather than later in the next few weeks, in our view. Open enrollment starts on November 1st all across the country. And insurance rates and notices are going to start to go out and frighten the American people to death in the next few weeks. We need resolution of this. And there have been Republicans who've now introduced legislation to say they agree that we need to extend the Affordable Care Act subsidies in order to prevent this dramatic increase in premiums, copays, and deductibles. But in our view, we need to extend them permanently. They have broken our healthcare system. We don't need a Band-Aid-like solution.
And I'll just add, so I can close, it's going to cost us more money when we cut subsidies. When people are not healthy, when our communities are struggling, when our health care system is struggling, it's more expensive for all of us. We talked about this from a human perspective, from a fiscal responsibility perspective. For all those reasons, it's critically important that we make the investments that make our communities healthier, save lives, and make us stronger economically across the country and make us stronger fiscally. For all those reasons, the American people know that. We're going to continue to fight for that in policy as we go back to Washington, D.C. next week. But We're going to continue to fight for it every day. Number one issue for American people across the country, wanting to see costs come down, wanting to see working families be the priority. And unfortunately, the priority for Republicans in Congress is the wealthy and the well-connected. I want to thank from Overlake Congresswoman Dr. Schrier, many titles, Leader Jeffries, and obviously the Governor and Maya for being here with us today. Thanks, all of you.
Okay, yeah, sure, that's what I'm